Okay, good afternoon, everyone. Welcome to the Kupuna Caucus. It is now 2 o'clock. We have a very full agenda, and I want to thank our speakers who will give us updates on the programs that we have. At the last meeting, Daintree had mentioned the Rapid SOS Emergency Health Profiles overview that we should have. And so we do have Royce Murakami. Royce, are you on? Maybe he's not on.
I see his name here. Here he is.
Oh, okay.
Hi, Senator Moraki. I'm here.
Okay, you are. Great. Well, welcome, Royce, to the Kupuna Caucus. If you can tell us what exactly this SOS Emergency Health Profile program is and where you are on it.
Okay, perfect. Yeah, I think you were kind of familiar with it a little bit this past session. So for the people that do not know what an emergency health profile is, it's a free opt-in service that securely links your medical information to your phone number. That data is automatically sent to a dispatcher, allowing first responders to arrive on scene with pre-existing conditions, allergies, medications, and emergency contacts. So this past legislative session, we had SB 2267 and HB 1577 that was introduced by Daintree. It required the 911 board to create a statewide emergency health profile system. Unfortunately, it did not pass, but it was converted into Senate Concurrent Resolution 62. So over the past few months, during this past legislative session, we've been in contact with Daintree and a lot of the other different agencies, DCAB, Aloha Independent Living Hawaii, Office of Aging, to ensure their participation throughout the process. So all the agencies have been invited and have been regularly attending our monthly board meeting since March. Let's see. So in that time, sorry, is everything okay, Senator?
No, I was just wanting you to give an overview of what it is and what's going to be included in it, if you can.
Okay, I can skip through all of this, but I just wanted to, for
okay.
everyone else
that
was,
yes, I don't mean to interrupt. Go ahead.
Sorry, I know it's a lot of information and a lot of things happen. So
yeah, it's a good program. So yeah. Tell us.
So during legislative session, we had two potential vendors. One was Motorola and one was Rapid SOS. We both had them give presentations during our board meeting. That was in April and May. So we did receive proposals from them. We did get presentations. We did have our technical committee review those things. And that was in relation to STR 62 to make sure that it met all the requirements. So the technical committee met and then gave its recommendation to the board in June during our June meeting. So we actually went ahead and we went with Rapid SOS. One of the main reasons was to ensure that there's no disruption to ongoing operations. It's currently active in all 4 counties right now. So with your mobile device, if you did sign up, it would be working today as of right now. So as mentioned before, another thing was too, I forgot to mention, I know the Kupuna Caucus was in support of Smart 911 previously, but that was back in 2015. Unfortunately, adoption rates were really low at that time because the solution required everybody to go on a website to apply and create an account. So it didn't get much traction back then in 2015. So with Rapid SOS, it is a free service for the public, but a nice bonus was that it was also free for all the counties. It's a free service, free platform. If we went with Motorola, it would be an annual subscription base and also additional costs for integration. So that was another big determining factor. Another factor was potential expansion. We also want to start doing more things with Rapid SOS. There's a lot of interesting things out there. So I will, is it okay if I share my screen, Senator? I'm not too familiar.
I think, yeah, I think everybody can see what.
Uh, not too familiar with
On the
sharing.
bottom, there should be a share button, Royce.
I
Yeah,
see.
at the bottom of your screen.
Below, you have down at the bottom of your screen, it says share.
Yeah, give me 1 second. Sorry, can you guys see my screen?
Yep.
Okay, perfect. So these are some of the flyers that we actually created back in March, kind of like when this all began. We actually attended the DCCA Consumer Protection Fair. So these are some of the flyers we put together, just for the mobile part of the Rapid SOS solution. So it primarily uses Apple and Google emergency health profiles, which are already integrated into your phone. So it would display name, date of birth, primary language, medications, allergies, medical conditions, emergency contacts, as well as an additional section for other information. So on the bottom of this flyer, you can see this is kind of what it looks like on your mobile device.
Royce, can
For
you expand it so we can see, because it's kind of teeny.
kind of teeny. Okay,
Yeah,
maybe I'll just do this one first.
so that at least we can see what it says.
Is this
Yeah,
better?
yeah,
Yeah.
yeah.
Okay.
Thank you.
I'll use this one because I know most people are all on Apple or iOS. So this is actually located in your health app. If you go to your profile on your health app and then you go to medical ID, how you see there, all this information you're able to input directly on your mobile device already. Um, the only thing that you would need to opt in, which is that opt in feature, is this feature right here where it says share during an emergency call. So this is giving consent um, to Apple that if in an event that you do have an emergency and you call 911, this information will be shared and transferred over to a dispatcher. So being that the information is stored on your own device, you are responsible for your own data and making sure that data is also accurate as well. So um, that is just one portion of it, the bigger portion of it. Let me see. So the next portion of it is called emergencyprofile.org. So what I just covered was just for mobile phone users. Um, this website is in partnership with the American Heart Association, American Red Cross, and Direct Relief. So the website serves as an alternative for individuals that don't have a smartphone. So if you have a mobile flip phone, anything like that, you can also go to this website, create an account, verify your phone number through SMS text, and then you would also be able to do the same thing as you were on a smartphone. So it's a nice alternative. We did talk to Daintree, and I know one of the bigger issues was it didn't support landline and VoIP. I know for the elderly, that's a big thing. I'm sure your grandparents and stuff like that still use landlines. I know a lot of them, like some of my grandparents, they're slowly turning to more mobile phones. You see it a lot more lately for a lot of things. So um, one thing that Rapid SOS did do to address this issue is that they created a call verification feature. So this way it would be able to support landline and VoIP users. So they would call in, and then that's the way that they would verify their number. They would get a call back saying that their phone number has been verified with their profile. Because normally it's done only through text messaging as of right now. Let's see. I
But
can't quite take you to.
Joyce, when it's on this landline, how do they
Mhm.
get all that information that you can easily do on your iPhone?
So you would create your profile on this one if you have a landline or a VoIP phone number, and then that way it's connecting the information to the phone number. So when that phone number initiates a 911 call, it'll pull the information from this website.
So you still have to go on the computer. Somebody has to help you go on the computer and put all the information in on the website.
Yes, yes, for landline and VoIP. I would highly recommend people that have an iOS or an Android phone to do it that way. It's a lot easier, it's a lot simpler. It's something you always have on you, so you can always update it anytime. Um, but I can go through a couple of other things too that we're gonna do to the website.
Mhm.
So a big issue with the website was initially this website kind of came out during COVID, so it hasn't been updated in a very long time. So Rapid SOS has been meaning to update it. So we had a lot of suggestions and stuff from Daintree guys and some of the other agencies to kind of make it a little bit simpler for the community to use. Um, so one of the things that we did was it does include all the same information as the Apple and Google health profiles, but for ease of use, we wanted to include kind of like checkboxes or drop downs. Previously, it was just all text boxes that you had to type in all the information yourselves. So what we did for each question is it's gonna have like a structured drop down selection of like the most popular answers nationwide. So for example, like medical condition, heart condition, diabetes, all that kind of stuff will just be automatically on that page as a drop down. Um, we also didn't want to take away all those free text fields because those answers may not be correct for the person actually filling it out. If they wanted to put more information in there, they're welcome. Another big issue that they also added was a category for mental health. So people with substance abuse, there is a category for that that they can also add on there as well. Um, Next up, um, I think this is a good one, especially for the Kupuna Caucus. It's a feature that's going to be um, on the emergency health profile website, I believe. I would have to double check with the vendor, but what they're creating is called account and care profiles. So basically, it's account that a caregiver can set up, and that care profile would be attached to the dependent on profile, and that data is then returned alongside with the caregiver's profile. So if the caregiver calls 911, their health profile will also show up to the dispatcher as well as the person that they're taking care of. So that's something interesting. The feature is not out yet, but that's something that they are planning. Um, Another thing that they did go over, the last thing for the website was advanced healthcare directives. I know that's another issue. So unfortunately, Rapid SOS does not have the capability right now to upload images and files to emergency health profile. But they do have a partnership with a different organization. It's called AD Vault. It also is another website free for the user. They can upload their advanced healthcare directives for free. And these documents will also be shared at the same time that their health profile comes in through 911. So it is a partnership with Rapid SOS. So it is a little bit of a workaround, but that's something that they do offer, and it is free of charge. Um, I believe that's all I have for the website and for the mobile users. Did you have any questions,
Yeah, I think
Senator?
people might be concerned about the privacy issue. I'm giving you all my data and all
Mhm.
my information. How is that being protected?
Well, they have all of their own terms of service, I believe. So all this information is not treated as HIPAA. So it's not covered under HIPAA because the user is inputting it themselves and they're verifying their own information. That's why it's so important to make sure that the information is accurate.
So it's
Um,
available. How does it become available just to the first responder, or that is not kept by say the, I don't know, police department, whoever collects that
it's
info.
not so for example, for the mobile phone users, it's stored directly on your device itself. So the data is only pulled off of your device and transferred over when a 911 call is initiated. So once that 911 call is over, the dispatcher doesn't have access to that information
Okay.
anymore.
Because I think
Uh,
people want assurances that, you're not keeping my data, especially with the vulnerable.
Yes, and I know HIPAA is a real concern too, but this doesn't apply to HIPAA because it's not transferring data to any doctors, hospitals. The data is purely for emergency response.
Okay, well, thank you, Royce. Are there any questions from anybody? Either use your raised hand or raise your own hand. Any questions of Royce? Oh, I don't see anything.
Oh, I am.
Oh, okay. Yes, yeah, Rick.
So I just wanted, go off of what you're asking as well, Senator. So when I was collecting information for Hawaii Meals on Wheels to set up check-ins during the pandemic, many of our kupuna were very, very concerned about giving that information.
Mhm.
So I just want to highlight that and scams are huge. It's too easy to actually get somebody's information. So I want to make sure that as this goes forward, that's really taken into consideration. How do we keep that information secure? Somebody gets my phone and they find my personal information, the wrong person's going to use it against me. And it's just, it's too rampant out there right now. So assurances around that's going to be helpful. We got to the point that we could actually work with most of our kupuna. Many are not going to give the information though. That pushback was huge. So just going with what you're saying, Senator, but kind of our experience during the pandemic as we collect and continue to try to collect information from folks. They're real nervous about sharing that information. I know they'll be in a crisis. I know that we'll need to relay the information.
Mhm.
A lot of what happened when I was doing in-home care services is there was a form that was filled out. They would keep it in the freezer. That's the first place that the paramedics would look. That was more secure. So just sharing, there are some things that we've used through the years to collect information from folks when need be. All for this, I'm just saying security is huge. And I'm coming off a very good friend, Linda Coble, who just lost a lot of money being scammed. It's too easy to get scammed. We also had at Rotary presentations where what's going on around the world is these scammers are really just lurking and looking for any little slip up and taking advantage. So I think it's like $31 billion of scams just last year alone versus 7 billion the year before. So it's a huge concern. And as kupuna are aware of that and their families, we got to be very careful to protect them. I also was the first responder. I was a field med corpsman, and so I understand the need for the information as well. So I
Mhm.
walk on both sides of the fence. We didn't have any of this online stuff back then. But just saying, just bringing it to your attention as we go forward with this. Great program. The security it needs to be assured that the security is there. We need to be very careful that we stay on top of what those security needs are. Got to change it from time to time just to keep it secure as well, because these are sharp people that are ripping people off. So I'll just leave it there. Thank you.
No, that's a great. Oh, sorry, Senator, you can go
Yeah,
ahead.
no, so just to if you could respond to that, but also what kinds of protections are you looking at, and when will this become operational so that there's time to develop these kinds of safeguards?
Well, that's another thing that we're kind of working on too right now. It's so early right now, so hopefully within the next couple of weeks, we're gonna have the call verification feature ready, and then the website should be fully updated at that point. So I'm gonna rely on Daintree, sorry, and some of the other agencies to get their input, because we're also gonna have to create outreach materials, whether it be for instructions for setup, also best practices. That's something we're also looking at. Um, I know that security is one of the main concerns as well. Um, but as far as security, when you're talking about having the data stored directly on your phone, in essence, you're responsible for your own data, and that's probably the most secure you can get it, right? Because it's not going to be through a third party. The data is being stored as well, right? It's stored directly on your phone. And also, Rapid SOS, as far as I know, has had no data breaches. Their security is very good, and their servers are only shared with emergency responders. It's a emergency responders platform only, so it's not shared with doctors. It's not shared with anything. It's only fire, police, and medical agencies.
Are there other states that have used rapid SOS, or that you can bring to us to show us what the security is? I think that's the biggest problem, is the security, because as Rick has said, there's so many scams and people are being scammed here,
Mhm.
that the people are afraid to give any information, even if it's on their own phone. They don't know how much of this, even giving it to a third party, would be secure, and that it'll be wiped out after they give it to them,
Mhm.
but
As far as I'm concerned, I don't think there was any issues. I know for a fact there's about 5,000 different public safety answering points that use rapid SOS, and are already using the system in the US. So I'm not too concerned too much about security. I think the most important thing is the best practices thing, ensuring that they're always updating their information. Yeah, I think especially for the elderly, I feel like it'd be the most difficult. So I know we want to do a lot more community outreach. It's something that we've been kind of lacking on for the last couple of years. So um, I've talked to all the counties; they're in agreement. This fiscal year, we're going to try and really push to at least do one community outreach event in each county, just to have for set up for best practices and stuff like that. So actually, the first one that we're doing is actually sponsored by DCAB. It's their second annual communication access conference for the deaf and blind. I did confirm with Rapid SOS already that we're going to have a speaker there just to go over overview. And hopefully by then, that's our intention and our goal is to have that best practices all ready and done by then. Just so we can start getting it out there, because it's gonna take not only us but help from like a lot of the other agencies to make sure we're reaching the right audience, right? Ensuring we're doing the correct events, and we're gonna rely on them for their recommendations as well.
So is there a timeline in terms of, this, going through this testing and then being
So testing, I believe the call feature should be live hopefully within the next couple of weeks.
Mm,
It's completed already. It's just kind of going through legal review for the terms of services. So we're just waiting on that. And then once we finally see like the final product, because I believe they already tested the call feature, so it does work. And then if you did sign up today on your iPhone or your Android phone today and you called 911, it would work today. So it is fully operational in that sense. But
Can you
um,
can you give us, or put it in the chat where people can get information on signing up?
okay, yeah, I most definitely can.
Yeah, put it in the chat, because I think people would be interested, and especially if you're gonna go live in several weeks from now.
Um,
Yeah.
would it be okay if I sent it out a little bit later? Because I think I would rather wait until the website is fully updated and then
Okay.
the call feature is active.
Mm, mm, mm. Yeah,
Because
send it
that's when
to
we're
us, and then we could send it out to our Kupuna Caucus members.
okay. Okay,
Once you're active, when it's up and running.
of course, yeah, we'll do.
Okay. Are there any other questions for Royce? I don't see any hands, and I don't see anything in chat, so I think that's it. I really appreciate your coming by, Royce, and sharing information on this very important project. I think it will help a lot of people, especially during, times when you have an emergency, you don't know what to do. At least somebody has information.
I think Tawny has a question.
Oh, okay, Tani, I can't see any hands up, so.
Aloha.
Hi.
Can you hear me?
Hi,
Are
Tani.
you?
Yeah, okay, hi.
Hi, I'm Tawny. I'm calling with some questions. Sorry if I missed this. My Zoom was cutting in and out. But my question was, since the rapid SOS is tied to a phone number, I was like, what if an emergency happens and someone calls on behalf of someone else? Like maybe the caregiver is calling on behalf of the senior, of the person with a disability that they're living with. Since it's not tied like to an address, was there a workaround to ensure that the first responders get that information as soon as possible? And forgive me if I missed this when my Zoom was cutting out.
Yeah, so it's always going to be attached to a phone number. I think there's issues when you attach it to an address. The dispatcher should always verify who's actually calling and then who the medical information is actually attached to. Um, I don't know if you came in the tail end, but that program that they're talking about creating for the care profiles for the caregivers, that one's not quite active yet. But if a caregiver were to create one for the person they're caring for, both their profiles would show up at the same time. So if the caregiver is calling 911, their profile and the person that's connected to it would also show up at the same time. And then the dispatcher would be able to verify who's actually in need of medical assistance, right?
Yeah, and also, Royce, we're also working on, remember, we're talking about the day program calls and they have different individuals there. So that is something that further discussion with Rapid SOS, I believe you said we're going to have if somebody calls and there's like 7 people or 8 people possibly there.
Yeah, I believe you can attach multiple profiles to a specific number. I think that's what they went over in that section. So then again, it's also the dispatcher also verifying who's actually calling, who's actually in need of assistance. And then that way they'll be able to look at the correct profile, right?
Mahalo.
Okay,
No, no problem. Thank you.
thank you. Anybody else that I can't see? Just speak up.
But just really quick,
Okay.
this might have been said, but basically everything Smart 911 did, we've been working with Royce and Rapid SOS format to put the same thing. So everything we liked about that, we were able to really incorporate things. And I just want to give a shout out to the 911 board for really taking in our recommendations. We're looking at a survey as well to see what else we can do. So it is still a working platform that they've really welcomed our input. So I really appreciate you guys being here today as well, and Tawny, that question and any input we can, because they're really helping us out. So thank you, Royce, very much for that.
Well,
No,
one
no problem.
question,
Thank
Royce,
you.
one more question. You said that the counties already have this. So what do the counties have that you're building on, or how does that relate to the counties?
I would say it's more specific that we just need to get the word out that the service is available. Um, so for Smart 911, when it first launched in 2015, it was only Honolulu County that was actually using it. It wasn't actually Maui and Big Island. So with Rapid SOS, actually every single county has a contract already with Rapid SOS. So they're already have the capability to receive this data. It's just more so getting the public educated about it and having them sign up. And then we already, I think, covered the biggest hurdle, which is ensuring that the landline and the VoIP guys are covered as well. Because as of today, if you were to sign up, it only covers mobile phone users.
So this will be consistent statewide. So if somebody's visiting the neighbor island and something happens when they're there, how does
Yes.
that work? That and then would hook up with the county.
Yeah, it would also work if you're also traveling in the US as well.
Hmm.
So if you're like in California or Montana, if there is a public safety agency that's using Rapid SOS in the area and you call 911, they'll be able to pick it up as well.
Yeah, that's great. Anything else? Anybody? Speak up, because I can't see you. I can't see hands and I can't see reactions. Okay, well, thank you so much, Royce. Really appreciate it. And let me know if you want to come back anytime with updates that you have. But I think we really appreciate your doing this and connecting up with our agencies so that it really is user-friendly.
No worries. No worries.
Okay.
Glad we can
Thank
help.
you. Aloha.
All right. Thank you guys.
Okay, bye. Thank you. Okay, thank you, Royce. And is Meredith on? Meredith, are you there? We have Meredith Nichols. She's our new MedQuest director and administrator, and she was to give us an update on MedQuest and Medicaid. Alex, could you call Meredith, or let me just see if I can text her and see that she's around. And then in the meantime, wait now, let me just see. And Alex, make sure that you send to Meredith the link. I thought we did send it to her, but just in case. I just texted her. In the meantime, can you put up the bills? You can talk about the bills that have been passed. So we passed, we were very successful. I'll go into the legislative package until we find Meredith. Kupuna Caucus did well this year. We have the state plan for hearing loss, was already signed into law, as well as the Medicaid fee increase, and that's why I wanted Meredith to come and speak to us. Both of them have been signed by the governor. We are going to hear and get signed on HB 1973. This is the Kupuna Aloha bill. SHPTA is the administering agency, and they are going to be putting that program together, as well as see the Hanai Memory Network, HB 1853. Both of those are going to be signed on Wednesday. We've gotten word from the governor's office that there will be a signing. So those two will become law. And because none of the other bills have been on the intent to veto list, we are expecting SB 2866, which is the rent supplement program, making that permanent for Kupuna. It's the Kupuna rent supplement program, as well as a long-term care financing program. Both of those bills probably will become law because they were not on the governor's veto list. Are there any questions on that?
Senator,
Yeah.
I
Yeah.
think the bill signing is on Tuesday, next Tuesday.
Yes. Thank you.
Yes, sorry, Senator. That's my mistake. The bill signing ceremony is indeed on Tuesday as
Oh,
opposed
yeah.
to
Oh,
Wednesday as it
okay.
is on the
All
screen.
right. On Tuesday. Sorry, it's on Tuesday. And Alex, could you get a hold of Meredith?
It went immediately to voicemail, unfortunately.
Oh, okay. Well, unfortunately, I wanted to get an update on what's happening with Medicaid. And she was supposed to be on, but let me see. And I just texted her. So are there any other questions? Anything else? Any announcements? Any questions? Anything? While we're here.
Hi,
Senator.
Oh,
Oh,
is
yeah,
that,
go ahead, Amelia.
that
I was just
Amelia?
going to say Amelia's here. Go ahead, Amelia.
oh, Amelia's here. Okay, Amelia, are you representing?
I'm with the
Okay.
Hawaii State Council on Developmental Disabilities with Main
Yes.
Street.
Yes.
And I just wanted to share about our caregiver campaign that we're working on.
Okay. Please do.
So we've been working with Tani with the Agency on Elderly Affairs, Executive Office on Aging, sorry. And then along with Lanakila Pacific, Center on Disability Studies, and to create this caregiver campaign to increase the amount of direct care workers across the state. So right now we're asking senior agencies, people that are supporting seniors, if they have any direct care workers who are willing to participate in the caregiver campaign to be filmed. It's going to be going on social media and televised through Olelo. And so we're just looking for more people to kind of participate, to be part of it. I have a letter that I can share with everybody that kind of outlines some of the questions that they might be asked and the time commitments and things like that. So I just wanted to kind of share that information. Daydream, was there anything else?
No, that was about it. So then just the caregiver campaign, and then in August, what we're having with Generations Magazine.
Oh, yes. So we will have partnered with Generations Magazine to be part of their Aging in Place event on August 1st at Ala Moana Hotel and Convention Hall. And that is kind of an all-day event. We have presentations in the Carnation Room that we're going to be putting on. Adrian Tani will be presenting. We also have Scott Gardner is going to be presenting on Medicaid and Medicare. And we have Dr. Poki Balaz who's going to be presenting on dementia and IDD. So some really great presentations. It's free for anybody who wants to participate. I'm just finalizing the flyer for that, and then I'll be sending that out. So we can send that to you as well to share it to everybody.
Yeah, we're not sure if Congresswoman Takuda is a maybe right now, so we're trying to get finalized if she's going to be able to be there or not.
Great. Sounds good. So what was the date again?
That is August 1st.
Okay, August 1st at the Ala Moana Hotel.
Yes.
And that's
That's a Saturday.
okay.
Yes,
And, but from what time does it start?
I believe it starts at 8 a.m.
And do they have to register or they can just come?
No need to register. They can just show up.
Okay, very good. Okay, let me see. I don't know if Meredith is on. Meredith? Not yet.
Not sure. But thank you, Senator. Yeah, we just want to share our caregiver campaign, how it's been going, and we're getting more caregivers to kind of work, develop our workforce in that area, and then our aging pace with the Generations Magazine. So thank you for this opportunity to let you guys know about it.
Yeah, well, thank you for all your good work. We really appreciate that a lot. I don't know if we're gonna wait for Meredith or not. She just said she didn't have it on a calendar, but I don't know if Alex, does she have the link? Can you send her the link to
Yes,
the
I
meeting?
just resent her the link.
Okay. So we can wait a few minutes, but otherwise, any other announcements? We have a short meeting because we thought that we wanted to have both of them share something timely in terms of Medicaid and what's happening on the federal side, but also from the bills that passed for Medicaid and supporting our vulnerable and our kupuna. Let me excuse me for a minute. Let me Wait, let me tell them to wait because you're getting on. I got Meredith on the line, so if you will bear with us in a few minutes, hopefully she will be able to get the link to get on. I guess we didn't send her the link earlier this week, so our fault. But if you will hold on, Meredith Nichols, our administrator for Medicaid, MedQuest, will be on to give us an update. Apologies. We will hear from Meredith soon. We hope the link goes through. So
aloha, everybody. Glad to finally make my way to this meeting.
okay, great. Oh, I can't get my video. Well, welcome to Meredith Nichols, our administrator for MedQuest, and we asked her to tell us about any updates from the federal side. We were all worried about cuts and so forth and what might be happening. So if you could give us an update on federal, and then also what are we congratulating you for?
Oh,
Tell the
so
lady.
the department, I'm over here in the Lily Kalani building. Usually the MedQuest offices are in Kapolei, but today was the day for our Department of Human Services service and awards ceremony. So a bunch of us, were down here today celebrating earlier at the Capitol.
So what are we congratulating you for?
Thank you. This was my official 10 years of service with the Department of Human Services. I worked for the state back in the 90s for the University of Hawaii for about 10 years there. So and then took a break and worked in private sector. So 10 years now with the Department of Human Services.
Wow, and congratulations. Thank you for serving the state.
Oh, my absolute pleasure. I really love the work. It's important work. Okay, so bear with me while I pull up. I have something, if I can get it up, that I'd like to share. Just one moment. So, and apologies, this is taking a bit longer. One of the things that I've noticed in this building is the connectivity, maybe because I don't know, because of where this building is, the connectivity isn't excellent.
Yes, we know. We're trying to get through to you.
Yes, I'm glad. I was on another meeting. So anyway, I'm glad to be here now. I told the other meeting, wait, there's a different meeting going on. I'm sorry, I have to leave early. I can just speak to some of the updates. So on June 1st, the interim final rule came out around HR1. HR1, just as a reminder, is the rule, the law that Congress passed that it did a lot of things, but the thing we're talking about here is it made work and community engagement requirements part of the eligibility criteria for a certain subset of the population. So what I want to be really clear about for all of us is that work and community engagement requirements do not apply to our kupuna. So if you are 65 or older, or if you're receiving Medicare Part A or Part B, then the work requirements don't apply. There's no change for you. So I want to say that really clear up front, especially given the nature of this call and what everybody here we're really focused on. But it's also important just to know what the impact is for everybody else, right? So it does not apply to kupuna, does not apply to keiki. It applies to those between 19 and 64 years old who are part of what's called an expansion population. The expansion population are those people who traditionally under Medicaid, old Medicaid rules, you wouldn't have been eligible for Medicaid. You make over 100% of the federal poverty level, but under 138%. So that segment typically states that expanded with the Affordable Care Act, and Hawaii expanded. We actually expanded before the Affordable Care Act because we're very progressive and forward thinking. So most states at this point, about 41 states, have expanded. A few states have not expanded, but this rule only affects expansion states because the rule only applies to expansion adults. So again, between 19 to 64, and if you're in that expansion category. So we have right now about just under 390,000 people covered under MedQuest, about 126,000. So about a third of the population falls into that expansion adult category. The other 2/3 does not and is not impacted by this. So of that, about 126,000, we know that some people will qualify for exemptions. And some of those exemptions, I think when we met several months ago, we talked through those exemptions a little. If you are disabled, if you're medically frail, and I wanted to, and the presentation that I want to be able to pull up talks a little bit about that medical frailty. You know, the rule that came out recently further defines what medical frailty is. And I have that presentation now. It's just opening, and I'll share it momentarily. So also, if you're a veteran with 100% disability rating, this does not apply to you. If you're a parent or caregiver for somebody who is 13 years old and under, so you sometimes you see the age represented slightly differently. So I think I'll clarify for all of us. It's if the child is 13 or under and I'm the mom, then I don't have to meet community engagement requirements because, you know, feds say, hey, you're busy being a mom to these children. So 13 and under, sometimes people will say under 14. To me, when I hear two different ages, it gets confusing. Yeah. But really, 13 and under is the same thing as under 14. So I'm just, you know, calling it 13 and under as I'm speaking with you. But if you're thinking, but I saw 14 somewhere, just know it's the same. It's just under 14. And let me now share the screen so that for people like me who learn best when I hear it and see it at the same time, maybe this will help. Where is the share? Oh, there it is. Share screen. Okay. Hopefully, are you seeing my screen yet?
Oh, yes, it's up now.
Okay, great. So I won't spend too long on this because we've reviewed it before, but this is just how we track our volume of applications. So we're this dark blue line. That's our volume of applications right now. We track that on a weekly basis, and you can see since 2019. We actually started this chart in 2020 when COVID came about. That's that big purple line where we knew lots more applications coming in because of the COVID public health emergency. And especially for us with our service-based income, a lot of people lost their jobs and lost their employer-sponsored income. So more people came to MedQuest saying, hey, I lost my health insurance. Can you please cover me? And we did. And we were happy to do so. We've now come back down to more, you know, actually below normal. If you look at 2019, this pea soup green colored line, that was the normal application volume. And now our application volume is a lot lower. And I think part of the reason is people stay covered longer, which is a good thing. This is just applications island by island over the past 2 years. And this is the slide I wanted to get to. So as of July 6th, which is Monday this week, we currently cover 384,000 people. Just about 385, actually, if you round up a bit. What we know is, again, during public health emergency, our enrollment went all the way up to 468,000. And that was 3 years ago, if you can believe it, when the official end of the COVID public health emergency. During the first year, as anticipated, you expect, if we used to be at 327, and then we went up and up and up, you would think logically that when COVID public health emergency goes away, we would come back down to kind of that area, but we never came back down all the way to that level. We did decrease, especially in the first year, the first time we're doing eligibility renewals for many of these people who hadn't been renewed in like 3 years. We found a lot of people who were either no longer eligible or a lot of people who told us, thank you so much for the coverage. I don't need it anymore. I'm back to work. I have employer-sponsored coverage. So we're very grateful for that. And so we continue to do this, track this report. We continue to see a slightly downward turn, and we're tracking that. We think that by January of next year, maybe we'll be at about 371,000 people. So we'll continue to track that. And this is that exact data, county by county. I added, so many of you have seen this chart before, but for those who may be seeing it for the first time, the numbers in blue are what you want to look at when you're wondering today, or as of Monday anyway, how many people in each county are covered. I added this new segment on the right to the slide because I think it's interesting. Again, if we just look in blue, of the people who live in Kauai County, 30% get their insurance through MedQuest. On Oahu, 24% get their insurance through MedQuest. On Maui, 31%. And then on Hawaii Island, 39% of the Hawaii Island community gets their health insurance through MedQuest. Oops. And then this is that kind of that information I was going through earlier with the Affordable Care Act expansion adults. I think I said 126. It's 125 as of this week. It goes up and down between 124 to 127, depending on when I pull the data. We currently have, for the month of July, covering on average about 28% of the Hawaii population. Non-disabled adults make up about 46% of everybody who's covered. And then again, 125, the highlighted, that's what we're worried about, this population. Parent caretaker relatives is a different group. You know, I was just talking about people who have kids who are 13 years old and younger. But anybody in this parent caretaker group, they're not part of the expansion population. This means that their income is actually 100% of the federal poverty level or below. So for this group, they're not subject to the work requirements, even if their child is 14, 15, 16, 17, they're not subject because they're in this special group, not in the expansion group. The parents in the expansion group, so maybe they make more than 100% of the federal poverty level. So they're covered by Medicaid, but in this category, sometimes we call it low income adult or LIA. Those are the ones who they're keiki. If they're 13 and younger, then they're not subject to the work requirements. We also cover about 1 in 2 kids in the state, or 153,000, and about 55,500 in our aged, blind, or disabled category. And this is just, now I'm going to go, and I won't go in too much detail because I know you guys have been on the call already for a little while and I don't want to take up too much time kind of in the weeds, but wanted to share the interim final rule was published on June 1st. Again, this is about the federal work requirements. We went through some of this data already, so I won't repeat it. And then how to meet the new requirements. So if a person is subject to the requirements, they'll be required to prove some of these options. So you can, for 80 hours in any combination of work or job training program or volunteering, or anybody can show that they received household income of $580 or more in at least 1 month of the previous 6 months. It's highlighted because based on the data we're looking at, we think the majority of our people who are in this expansion category will likely qualify for an exemption based on this. Also, anybody who's enrolled at least half-time in an educational program is exempt from having to meet the work requirements. Other people who are exempt, we talked about the children or kupuna, people on Medicare Part A or B, anybody who's pregnant or in their first year, that postpartum period, no matter the outcome of the pregnancy, you get a 12-month postpartum period. They're not subject. We talked about parents or guardians or caregivers. In addition to a child 13 years or younger, also if you're a caregiver of a disabled individual, you're not subject to the work requirements because you're already working hard caring for that disabled individual. People with disabilities, including physical, intellectual, or developmental disabilities that make it hard to do activities of daily living. Veterans with 100% disability rating, people with serious health or mental health conditions or substance use disorder or issues, people who are released from jail or prison have 90 days before they're subject to the work requirements. If you're a registered American Indian or Alaska Native who's eligible for the Indian health, then you're not subject to work requirements. And if you're a former foster youth who's under 26 years old and you were in foster care on your 18th birthday, you're not subject to these work requirements. This question comes up a lot, so we like to make sure our people know now the best thing people can do to prepare, create your online account, because that way you can self-serve. Now, not everybody wants to go online. I tell everyone my mother is 90 years old and she has good computer skills. She likes to go online and play games. But when it comes to things like Medicaid or Medicare or taking care of business, she really likes to talk to people. And we always are going to hold space for people like my mom who just want to come in and talk to people. So by no means are we saying everybody should go online, but we want to say that if you're comfortable going online, it's the best way to keep your account active. Then you don't have to come in, you don't have to call and be on hold. You can do everything that we need by going online and clicking and answering questions. Occasionally, you might need to upload a document. You can then take a picture with your phone and upload it. So there's a lot of opportunity there. Also choosing to go paperless for our people who don't have stable housing. They change address a lot, or maybe they're unhoused, they don't have an address. We encourage those people, consider going paperless, because then we're not going to send you a piece of mail and it's going to get rejected and come back to us. And then we have federal requirements. It's called whereabouts unknown, that if we send a mail out to the address that we were given, it comes back to us. We have to do, and we try everything on your account. If you have a phone number, we'll call all the phone numbers that are listed on your account. We'll try our best to reach you. But if we can't reach you, then we're forced to have to procedurally terminate the case. That's a CMS rule. And so for our unhoused population, that can be really challenging, right? Or people who they know their address is unstable, because chances are when we send you a letter, it's going to get bounced back. And then that's how a lot of people who are still eligible end up losing their Medicaid. So my suggestion is, number one, when you change address, make sure you tell us. But number two, if your address changes a lot, consider going paperless. Well, what do you do if you're going paperless? That means we're going to be emailing you information about your account. So if you don't have a computer, we highly suggest, my husband is a proud public librarian, and he would like everybody to come into the public libraries. There are computers available for free. You just need your library card, and you can handle everything in your account online. All right. I'm going to go a little quickly through what I discussed earlier, which is this notion of medical frailty. So you saw, like in my, when I was speaking earlier, being medically frail is one of the things that, hey, if you're medically frail, you're not able to work, that can be a reason you don't have to meet work requirements. The interim final rule that was published on June 1st define medical frailty, but it's in a fairly broad, somewhat ambiguous way. And I'll show you what I mean. So there are basically 5 categories. If you're blind or disabled, if you have a substance use disorder, a disabling mental disorder, a physical, intellectual, or developmental disability that significantly impairs your ability to perform one or more. An ADL is activity of daily living, or you have a serious or complex medical condition. You don't have to have all 5, but just any one of them, and you would be excluded. But what does that mean? What's a disabling mental disorder? What's a serious or complex medical condition? So in their rules, CMS, all 5, so in green on these slides, I've detailed like number 1, number 2, all the way through 5. So the first one is blind or disabled. That's fairly straightforward. The blind part is fairly straightforward. They provide the definition of blind. And again, I want to stress, if you're already covered in our aged, blind, disabled category, you don't have to additionally prove anything. You're already covered as exempt. This would just be for people in our low income adult category who may have visual impairments that could prevent them from working. So they define it as you have central visual acuity of 20/200 or less in the better eye when you're using a corrective lens or glasses. So that would be blind. For the substance use disorder definition, they're talking about individuals who basically struggle not just with, any particular substance. They have a list that they're looking at. This language at the bottom of the slide, where it says including alcohol use disorder, opioid use disorder, stimulant use disorder, all of those people would be eligible for an exemption, provided, and this is the caveat that the rule qualifies across all 5 medically frail categories, that the issue you're grappling with significantly impairs your ability to comply with the community engagement requirement. So, and of course, this list of disorders is not an exhaustive list. That's also true throughout the rule, that the list is not exhaustive. They just provide examples. Also, they break down substance use disorder into 3 categories. Early recovery being less than 12 months. If you're in sustained recovery, that's 1 to 5 years. So that's the threshold of who's eligible. Anywhere from 0 to 5 years can use this substance use disorder if it also prevents them from working. It's important to note that if you're in what's considered stable recovery, in other words, you've been in recovery for 5 years or longer, this does not apply to you. So you're considered stable. They also say CMS, and sorry, I should have clarified. What I've highlighted here, they're not my words. These are the words that I copy and pasted specifically from the interim final rule that CMS released, because I think people like to see the exact policy language it comes from. So what they're saying is participating in community engagement activities such as employment has the potential to help people in stable recovery maintain their recovery by helping them escape isolation and dependency, build confidence, achieve self-sufficiency and prosperity, and improve health. So this is the CMS rationale for why people in stable recovery are not included in, that opportunity to not have to meet work requirements. The third medically frail is a disabling mental disorder. So they're talking about conditions that impact an individual's thinking, emotion, or behavior and may impact an individual's functioning. And further, they clarify a disabling mental disorder may significantly impair an individual's ability to complete major life activities, such as their ability to work or volunteer, can be permanent or temporary. That is the definition. And again, there's that language right around, it's not just that you have a disabling mental disorder or any of these other categories, but that because of that, you're unable to meet the work requirements. Individuals with a non-disabling mental disorder would not qualify for. So if you have a mental disorder, but you're not disabled by it, then this would not apply to you. They gave a bunch of categories of things that could potentially qualify, but it's not an exhaustive list. But for example, as we talk about this, they're talking about, or you can think about people who suffer with schizophrenia, schizotypical disorder, delusional disorder, other non-mood psychotic disorders, moderate or severe bipolar disorder, major depressive disorder, and panic disorder. The fourth, so we're almost there. The fourth one is people with a physical, intellectual, or developmental disability that impairs their ability to perform one or more activities of daily living. Activities of daily living, it's highlighted below, for example, related to personal care, including bathing, showering, dressing, getting in and out of bed, or a chair, walking or using the toilet, or eating. These are people, if you have challenges with that, then you would be exempt from meeting the community engagement and work requirements. Yep, and CMS here in this middle highlight directs states to consider the effect of the physical, intellectual, or developmental disability on an individual's ability to comply with the work requirements. So, for example, they think things like muscular dystrophy, cerebral palsy, cystic fibrosis, spina bifida, Down syndrome, Fragile X syndrome. All of these things are examples, not an exhaustive list, of what might qualify under this category. But what CMS calls out is, and they used, for example, individuals with Down syndrome, they said they didn't want to say, if you have Down syndrome, you're not expected to work. What they're saying is many people with Down syndrome actively participate in work, they volunteer, and they don't want to say categorically, there's no expectation. They know that that's not going to be true for everybody. And if you say, yes, I have Down syndrome and I am not able to work because of my Down syndrome, I can't, I'm not functioning at that level where I can work, then that's okay, you're exempt. But if I say, I have a Down syndrome, I have a job right now and I really enjoy it, I'm good to go. Well, that's great. Then you're good to go and you're working and we support that. The final exclusion is for people with a serious or complex medical condition. So, for example, here they talked about things like HIV/AIDS, end-stage renal disease, cancer, sickle cell disease. But again, CMS states it's not reasonable to categorically consider any of these conditions as serious or complex without factoring in criteria such as the severity of the condition. Again, here the example was used of somebody who is going through, has a cancer diagnosis and is in cancer treatment, but maybe that individual with cancer and that particular treatment isn't impairing the individual, and the individual is actually appreciating the opportunity to continue to work. It's helping with their recovery and healing. They didn't want to just say, if you have cancer, you're exempt. That was very disappointing to a lot of people, as you can imagine, because it adds complexity to people who are like, well, you know, that might be the case for some, but it's not the case for everybody. And this puts at risk somebody's access to health insurance by having to say, yes, I have cancer and it is debilitating for me, I can't work. This, I won't go through the details. It's just old language that CMS was citing for what counts as disabled. Again, just for, and I can send you these slides, further language around what is considered disability. And more examples of what would be appropriate. Again, cancer, end-stage renal disease, viral hepatitis, chronic obstructive pulmonary disease, Parkinson's, Huntington's, cystic fibrosis. But here, interestingly, they added examples they don't expect to see people exempt based on things such as asthma, hypertension, anemia, generalized pain, prediabetes, type 1 or type 2 diabetes, obesity, psoriasis, headaches, or ADHD. Yep, and then just directing states that we would use diseases, diagnoses, disorders, but also that we have to figure out a data way to track acuity or severity. So that's the end of the slides. I want to add, because I know that's a lot, and I'll stop sharing screen. I want to also add that one of the glimmers, one of the good things that is in the interim final rule is that for 2027, CMS realizes the kind of data that's required in, especially in this area of proving medical fragility, the data sources don't exist yet. They still have to be developed. So for 2027, they're allowing self-attestation. And this is a very big deal. What this means is states are being allowed to develop a form where a member in that expansion population that's vulnerable can, of course, as always, under penalty of perjury, we don't encourage anyone to ever falsely represent their situation, but they'll have the opportunity to just click and say, click or a paper, you know, if I'm talking about my own mother, say, yes, I have a medical condition, and it is so severe that it prevents me from being able to engage in work or volunteer activities. So with that ability to self-attest throughout 2027, we could all breathe a little sigh of relief. Starting 2028, we'll need the data, but we were happy to see that CMS gave a little or a lot on this area of this is very complex and data is not ready across the board. So with that, I will mute myself and I'm open for any good
So
questions you
one
may have.
thing, one thing,
Yes.
Meredith, we just talked about the passage of Medicaid fee increases and what the impact might be, or how it might help our community, especially our Kupuna, with the medical fee increases that will be signed into law or has already been signed into law, I guess. Yeah, just a little bit about that.
Thank you so much. And thank you, Senator Moriwaki, for your amazing advocacy in that, because we couldn't agree more that it's important for all. And I hope I'm speaking to the point that you're queuing up for me. But even if I'm getting it wrong, I want to say this from the bottom of my heart. We're so grateful to you, Senator, for being such a tremendous advocate. We at Department of Human Services, the MedQuest Division, believe wholeheartedly without our caregiving community taking care of our people, you know, that it all falls apart. And they need to be paid more, right? They need to be paid more in order to stay in business. We were so grateful that this past legislative session, we were able to advocate for and get approved to move the rates for our caregivers up to that. We had a rate study that provided, here's what a low level increase would be, here's medium, and here's high. A couple of years ago, we were able to get that low increase approved thanks to the legislature. And then this past session, able to get it approved up to the medium level. So we hope that that will keep more of our caregiving community in business, so that there are places for our kupuna to age in safe environments.
And so it applies not just to residential, but also community-based services for the increase in the fees.
Yeah, there was a group that was left out, and I have to go back. I don't want to misspeak on this call. I want to go back and see that the final version, what was approved, so I can be really clear on, because I do think what happened was there was one group that was left out when we got the low level increases. So that group was brought along the year after that and increased to low. And so then I think this year, that same group that was passed the first year got passed this year. And then I think that in-between group we'll probably have to address next year. Yeah.
Well, let us know, because we want everybody to get the increase so that we
Agreed.
Yeah.
Yeah, we
caregiving and
agree.
community, yeah. Okay, are there any questions? I know we kept people over time. I appreciate your patience. It was our fault that we couldn't get the
I'm
information.
glad I was able to jump in.
So I'm just glad that we actually got you here, because I think it's really important work that you do, and just seeing what Medicaid changes are, and people can be, especially the kupuna, can be rest assured that they don't have to go back to work.
Rest assured, they don't have to go back to work. Of course, if they would like to, we love that, but you don't ever want your health insurance to be connected to something like that, right? Work is great. We think work is fantastic for people who are able to, and who, you know, but we worry about connecting being able to have access to health insurance with meeting these kinds of requirements creates a lot of vulnerability.
Okay, I don't see any hands, and I don't know, I haven't seen hands or on the chat.
Okay.
So I'm assuming, unless somebody speaks up, that there are no questions. Anyone? Okay, I guess you covered everything, and I appreciate your coming on, pulling you out of your meeting.
Hey, that's okay. I'm happy to be here. This is a special group, so I'm really happy to be here. Thank you for the invitation.
Okay, well, thank you. You get all kinds of claps, so I guess that's it. You don't.
Okay. All right.
Okay, and congratulations for
Thank you
being
so
here with
much.
us. We appreciate you. Thank
All
you
right.
so much.
All right.
Okay, aloha. And I think that will conclude our meeting today. Thank you for your patience, everyone. And we will see you next month. And if you have any kind of recommendations for whom we want to hear more from, please let us know. Just email Alex, and we will proceed. So again, thank you. Have a good weekend. Aloha and mahalo.